Good afternoon, everybody. Again, we have with us Garren Colvin, the CEO of St. Elizabeth Healthcare. Garren, thanks for giving me some of your time yet again.
Judge Knochelmann, it's a pleasure to be here, and thank you for inviting me.
You bet. So we're sitting here on November 11th. Give us an update on where COVID cases are with regard to the hospital.
So as of today, we have 98 inpatient positive patients at our Fort Thomas facility. Of those, we do have in excess of 12 that are in our ICU, and we have 6 individuals on a ventilator.
And how does that compare, Garren, looking back a week or two?
So if you look back a week or two, it's a pretty good jump. I would say 3 weeks ago, we probably only had maybe 50, 60 inpatients, very few in ICU, very few on ventilator. If you go back in that same time period, you probably had a positivity rate through all the testing that St. Elizabeth is doing of maybe 4% in our community. Move forward to today, we have 98 inpatients. At the height of the first surge of COVID, we only had 95 patients. So even though in this wave we're seeing a little healthier patient, we're still seeing the numbers kind of starting to increase significantly. And it's a time to reach out and ask our community to help us. And the only way we can do this is by masking, by staying in, by not congregating. When you are seeing the business that you need to see, do it respectfully, wear a mask, wash your hands, get in, get out, and take care of business.
You can't be any clearer than that. You've got this team of professionals who rely upon, and we rely upon in our community. Speak to that issue, the nurses, the doctors who are treating patients, and then we can talk about the kind of care they're getting, those who are admitted to the hospital.
Top to bottom, just unbelievable group of people who care about this community and care about people, doing just a magnificent job. This thing gets spread out so long, the stress levels are higher than normal. When you get this many inpatients, the stress level's pretty high. So we're trying to do everything we can possibly do to make sure that we're taking care of the physicians and the clinicians and the support staff that are making this ship run during this pandemic.
So speak to the 98 patients you've got. The number, you don't want that number to be any more than 0, but you've got different treatments that are happening in this third wave than maybe what would have happened here back in March and April, correct?
Correct. I think some of the high profile pharmaceuticals that were used early on, they're not even really utilized very frequently today. That everybody's getting better at treating it. But what helps is the strain that we recently have seen has been a little less potent. However, just in the last day or two, we're starting to see a little more critical individual coming in through the hospital. So I think it really depends on who it impacts. If it impacts a mature individual with maybe a comorbidity or two, it's probably going to be a longer, more of a struggle, a fight to get through, as opposed to a young individual with no comorbidities. We're typically getting them in and out pretty quickly.
So speak to that a bit, Garren. And I know you're not a physician. Everybody expects you to have not only financial and management experience, but be an MD. But speak to the issue of those who might say, you know what, I'll be a good citizen, wear my mask, but if I get it, I get it. I'm not old. I have no other health issues. I guess I'll get it when I get it, and I'll get out of it. I'm sure I won't go to the hospital. What do you say to that individual?
So I think this is the biggest problem with COVID. So many people are positive and they have no clue that they're positive. And then there are several people who are positive, they know they're positive, but show no signs or no side effects. So they think it's no big issue. I can still do what I normally do. And if I get it, I get it. If I don't, I don't. The problem is we have no clue as we sit here today, what are the long-term impacts of COVID on our bodies? So those who are positive today could have long-term impact that we don't know about as we sit here today. And that's my concern. If you can do anything possible to prevent it, you want to prevent it, because you do not want this disease. You don't want to fight it, and you don't want the long-term impact. We do know that the younger adults, athletes that we're getting in, we're showing strains of heart conditions, 2-3 weeks out. And so this is something that would concern me. So I'm back to what we said earlier. Let's mask. Let's not socialize when we don't have to. And let's get through this. The beauty of this, and maybe it might be your next question, is the prognosis of this vaccine, the Pfizer vaccine, at a 90% effectiveness. That's unheard of. The traditional flu shot's 50%. So there is so much hope on the horizon, but let's get to that point. Let's get there as quick as we can. We don't know how it's going to be distributed yet. We, being St. Elizabeth, is one of 12 hospitals authorized to distribute the vaccine once it makes it to the state of Kentucky. So there'll be a lot more to come on that front, but there's going to be a prioritization of who gets the shot first. And I can tell you, as we sit here today, if you would have asked me 3 months ago if I was going to take the first vaccine out, I would have said, heck no, no way. Now, if you ask me, I hope I'm first in line, because I want the vaccine, and I want it in this community, and I want this community to be vaccinated.
Well, and it's a great point you make. And I'm going to ask you about this. Things change daily, and you just alluded to the fact of how you viewed vaccines just a couple of months ago, or the potential vaccine. But it seems like there's a lot of things that as this develops literally daily, both treatment, reactions, the idea of masking. Was a comment that masking was only to help your loved ones and those people you cared about, but now their CDC's coming out saying you're really also protecting yourself to some degree. Speak to the issue of things changing. I mean, you're dealing with this on an hour-by-hour basis, really.
Yeah, I think the biggest evolution obviously is in the treatment and the pharmaceuticals. But I think, what I would say is what we've learned at St. Elizabeth through this pandemic is masking has stopped the spread of disease inside the walls of this medical center. So I'm a big fan of masking. Our infection rates related to that type of spread has dropped so significantly that I would say we're probably masking for life inside the hospital, or at least for the near future. And so to me, that's the biggest issue. I think we shouldn't be debating on a lot of these issues. We should do the things that we know help bend the curve. And we know what we did as a community last time. Maybe we went too far, maybe we didn't. I will tell you, whatever we can do to bend the curve is going to be the most effective way to stop the spread of COVID-19.
Again, you're very clear, and your leadership on this has been black and white, and you've just sent a great message of really since day one. One of the questions I get a lot, Garren, is the idea of testing. The drive-through out at Atlantic, which is going on, funded by the state, and really going to do a lot of questions, right? Businesses, people just need to feel better. They want to be, they're not symptomatic. They want to be tested. But this question of why can't we just immediately just be wide open with our economy and just do rapid testing? Everybody just get a test every week or get a test every couple of days. Speak to that a bit about the differences of the testing.
So a rapid test is a little less sensitive, and most of the rapid testing is the most beneficial, the most effective if you have symptoms of the flu. So if you have symptoms, you take a rapid test, the effectiveness is really high. If you have zero symptoms and you're taking a rapid test, the effectiveness is not that great. It's not as equal. I don't want to say it's not as great, but it's just not near as equal. And so when you're symptomatic, absolutely rapid testing is a great tool. When you're not symptomatic, rapid testing isn't the best way to prevent the spread of the disease. And the second component of that is the only time that a rapid test is truly effective is at the point in time that you've taken that test. So if you're in day 3 of a quarantine, you can convert to positive on day 4 and 5, but you think you're negative because you had a rapid test on day 3, it's a little bit of a problem. Now, the serum testing, which is the gravity diagnostic testing that we partnered with the state, that test is a lot more effective. But again, the turnaround time is, even though our drive-through turnaround times are about the best you can get at near 48 hours, that's still not good enough for business who wants to know on the minute of that test if someone's positive or not. So that's a little bit of a concern. The rapid testing, there's different platforms. Some platforms have supply issues, that prevent from just expanding that test to everyone. So I think you're going to find some supply limitations on PPE when it comes to just doing mass distribution of rapid testing.
That makes a lot of sense. And I know that I've done the drive-through before, and that process is seamless. And that is going to be available for at least another number of weeks, if not a month or so. But there's no guarantee after the first of the year that gets funded, et cetera. So we've still got multiple months that people, need to be very cognizant of the fact you're not going to potentially just drive down the street at no cost to get a test.
Yeah, I think that's kind of a little hidden treasure that the state and Dr. Stack and the governor has used the CARES Act dollars coming into the state to fund testing, and not every state has done that. So I think if you look at the number of testing the numbers of testing that's taken place in the state of Kentucky, it's pretty good as a result of the state stepping up and paying for that. I think that's a big expenditure, gigantic expenditure in the millions of dollars. We know that the state is committed in 4-week increments. They've promised us 4 weeks notice on when that funding if it would go away, when it would go away. So I think pretty safe to say we're good for the next couple months. But I think when the new fiscal year comes in from the federal government, things are subject to change.
So Garren, and I know this is serious stuff, and so we don't want to make light of it. And you're doing a great job to communicate the facts to the community, and we've got to be adults and look at the facts and not ignore it. But right now, as we look at the number of cases, let's say I'm a person who says, you know what, Garren, 98 beds, you've got so much room in that hospital. You've got plenty of staff. Everybody seems to be getting through this because we don't have many deaths. So why should I really worry? Why should I worry about having a big 60-person Thanksgiving party or a big, group that I'm going to hang out with for 5 hours on a nighttime and party it up? Why would I really care? Because nobody's dying. It's not that bad.
I would say, the one thing I would definitely say is the mortality rate in Northern Kentucky has been really good. But that doesn't mean that there's a lot of people that aren't here today that could have been here without COVID coming through. I think if you look at let me take a step back to something we talked about earlier. 3 weeks ago, 3 to 4 weeks ago, my positivity rate of all the testing that we've done at St. Elizabeth was between 3 and 4%. Then it jumped to 7%. Then it jumped to 9%. Last week, 12%. This week, 13%. So you can see an exponential growth. And then I think in that same growth, you can see the positivity and patients growing. If that would just compound and continue to compound, unfortunately, like interest does, then that number eventually may be too high for a community to truly handle in a way that you would want to handle it. Not to say we're not going to get through it, because we will get through it no matter what happens. But what's the ramifications? What's the downstream ramifications? What's the impact on this community? That's what we want to prevent. And without bending the curve, you're going to test that theory. And I say, let's continue to bend the curve so that we're not testing that theory. And a 13% positivity rate is significant. I mean, significant, especially when you look 3-4 weeks ago, it was 3 to 4%.
Great point. Well, and I somebody told me this recently and said, when the things that we're being asked to do, is it really that big of a deal to do it? Even if you have some issue, is it really that painful to put a mask on? Is it really that painful to stay 6 feet away? Is it really that painful to maybe not be with a big crowd? So,
I think, when late fall hit and things started to come back to a little bit of normalcy, so to speak, I think we kind of fell back in love with normal, and we forgot what we had just gone through as a region the few months earlier. And I just think we need to get a little bit back to reality. We need to support our governor when he's asking us to take some heroic steps. And I think we need to do that because it's the right thing to do for your family, your friends, your neighbors in this community. I think it's someone who thinks, if I get it, I get it. It's no big deal. But you're not looking at all the people that you're impacting by spreading it to some others. And a lot of those individuals are going to be your loved ones. And unfortunately, the one really huge negative of COVID is the restrictions on visitation that takes place in hospitals. It's the biggest frustration I hear. We apologize that we have to take those steps, but it's again, it's safety issues because we don't want to spread any virus that we can prevent from spreading.
And I guess to end on this note, I think it's a point you have made regularly too. When people do have other issues and feeling sick, probably one of the safest places they can go to is the hospital. Maybe you can speak to that as we wrap this up.
Yeah, Kris, I think, everybody knows I'm a numbers guy. My background's numbers. Statistically speaking, people haven't come back to their physician practices, to the emergency room, to their GI physicians at the same levels before COVID. So people who are in need of care aren't seeking care, and we know that. We have limited any transmission of COVID throughout the halls of our medical center, and we are safe. But we need our community to help keep us safe. So when you come to a visit, when you come to the hospital, wear a mask, wash your hands, and stay 6 feet apart.
Well said. And I think that these are very tough, unique times. Thanks to your efforts, and really thanks to the nurses, the doctors, the staff. I know we can't get the message of thanks to them all this way, but I know please pass that on for the community, and appreciate your work here, and thanks for the time today.
Thank you, Kris. Appreciate it.
You bet.